from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi everybody, welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about life after having a stroke and the resources available to the community and patients. Our guest today is Wanda Jackson, the Outpatient Care Coordinator here at Sarasota Memorial. Wanda, thank you so much for being with us.
Oh, you're so welcome. My pleasure.
First, let's talk about your role. You're not one of the physicians or nurses treating a patient with stroke. How do you fit into a stroke patient's life?
I am, title-wise, the Outpatient Care Coordinator. So there's a lot of things that happen during a hospital stay, but we have a lot of services post-hospital stay, and I help patients connect the dots with those services.
So according to the CDC, stroke is a leading cause of death and disability in the U.S. What are common symptoms that people should be on the lookout for?
Well, we've kind of narrowed it down to an acronym that we use called BFAST. B stands for sudden loss of balance. E is sudden loss of vision in one or both eyes. That can be double vision or blurry vision. The F is the only one I knew really a long time ago, and that's that face droop. A is arms. If you ask a patient to put their arms up, if one droops down, then there's possibly something happening on the other side. S is for speech. If you're with someone and the speech turns to what we call gobbledygook, nonsensical, or they're saying the wrong words to the answers to your question. And then S that's speech, and then T is time. It's time to call 911. This is an issue. A lot of people don't call 911 because they're of the school that if your bone's not broke or something's not bleeding, it's not 911 worthy. But any of these sudden onsets of these symptoms is 911 worthy. And the other part of the T in BFAST is they're going to ask you last time known well, because there are certain things that we can do when the rapid response team gets them at the ER, but we need to know the onset of when all this stroke symptoms happened. And there are other stroke symptoms that don't fall into BFAST. So you really have to know your own body, and the key word in there is sudden, because if there's a blood clot that changes something, it's sudden. Like a sudden terrible headache, sudden fatigue, sudden other things. That's where the key is, know yourself.
And Sarasota Memorial is designated as a comprehensive stroke center. What does that mean?
Well, it's a step above a regular stroke center. We just have worked to make it possible. 24 hours a day, 7 days a week, the right people are on duty, the right services are there for when you have a stroke, and either walking in or the ambulance is bringing you in. That rapid response team includes that neurologist, the scans, the medications, everything that you need. But we also have the services that follow up on that to avoid secondary strokes, and that's part of comprehensive.
SMH has that team dedicated to immediately responding to and treating stroke emergencies. But what happens after a stroke? What do some of those therapies look like?
Some of those therapies, well, it can start with going from the inpatient hospital to our acute care rehabilitation pavilion, and the therapies can start right there. After discharge from the hospital, we have physical therapists, we have occupational therapists, we have speech language pathologists who are trained in neuro issues to regain some of what's been lost, reroute it, and bring you back to a new normal, and to process all of that, because it can be very frustrating. We also offer a lot of other programs that extend beyond the actual therapies. So we work on nutrition and exercise and all the good things that are healthy.
We're going to break down some of those additional resources outside of just the medical treatments. Let's start with the stroke support group. Can you talk a little bit about what that is?
Well, it's Stroke and Wellness. We meet once a month, the second Wednesday of every month at the Rehab Pavilion, third floor education room. Again, it's just such a wonderful group. We love our people. We get to know them. And we start with some stretching. There's a lot of rigidity and sometimes left-sided or right-sided weakness that goes with it. So we work on some neuromuscular stretches to start with. Then we bring in speakers from SMH as applied to all things stroke. So we cover whatever the patients are interested in. We have a few that we hit every single year because we're trying to prevent any secondary stroke. So we will talk about nutrition. We will talk about medications. We'll talk about exercises that they can be doing. So we have a discussion, bringing in an expert, and then we finish with some stroke support. They can ask questions of our professionals, and then we ask them how they're doing. What is the one thing you've seen improvement on? Because sometimes they're not recognizing improvement. So it's always nice to finish with, where are you seeing improvement?
If someone has had a stroke, they might think, I can just go online, find resources, do my own research. But talk about the social aspect and the camaraderie and why that's so important.
There are things that happen that can change within their personalities. They're not things that you can discuss necessarily on an online forum even. So one of the symptoms that happens sometimes after a stroke is this weepiness, this crying. And for the men, I mean, we women cry at, every commercial. But for the men, this can be very devastating. And so in a group where someone says, I was like that, I still have those days, it gives them hope, but it also helps them feel like they're not alone. So support is good because nobody really understands like the people that are walking the walk.
Speaking of walking, exercise plays a huge role, even after rehabilitation. Can you talk about how HealthFit fits into that?
HealthFit, it's wonderful. It's a gym that's powered by Sarasota Memorial Healthcare. Some of the best and brightest employees are there. It's just a happy place to go. And because it's medically integrated and powered by Sarasota Memorial, we have clinical classes, things from balance and bone strength, and we work on all kinds of ailments, but we have classes specific for stroke survivors. So along with our comprehensive stroke team, Dr. Concha, and therapies across the board with our PTs and OTs, we have developed a class for stroke survivors called Fitness Forward. And we help them retrain the brain, regain, and then retain what they do. So we work on balance and walking and core elements that are a result of a stroke often.
And do your patients see a lot of success with that?
They do. When they're in the hospital, those first few months even, they see greater strides in their improvement. But then that can actually slow down. So every 3 months, we do measurements, because sometimes the increments get smaller as time goes by. So those measurements are really important for just the motivation behind the exercise.
And on top of exercise, there's a huge focus on nutrition. Can you talk about how SMH helps to address that?
SMH is great. I mean, I am allowed to do all these fun programs, and one of which is our Cooking Matters class we do in conjunction with All Faith Food Bank. We bring in nutritionists. We have a class. It's a 6-week class. It is free to the community. The stroke survivor and a partner can come, whether it's a spouse or just the person that drives them, caregiver. We do a 6-week cooking class. Usually we've been running it on Wednesday afternoons, where we talk about all things stroke healthy. Again, trying to reduce any secondary strokes and to get them healthy. So things like label reading, lowering sodium, lowering the fats in our diet. And we really work with the meal planning and the things that are specific to the people in our class. Not everyone's going to grow a garden of green beans or buy the fresh green beans, but there are healthy choices that we can make with reading the labels on a can of green beans. So it's fun. We chop, cook, stir, and eat together every week while getting this education.
And that also is a way to kind of help with outpatient therapy as well, right?
When we know we have a patient coming in that has a real severe right arm and they were, weakness and they were right-handed, we'll bring in our occupational therapists with devices that we can actually learn how to chop and stir. It takes some doing to chop a carrot, but there are actually devices to help stroke survivors do that.
You mentioned that they could bring with them a support person, a caregiver, because it really does take a village to help any stroke survivor or anyone who's gone through anything. So Are there resources available to caregivers, family members, loved ones to help?
There are. A lot of it goes side by side with a stroke survivor. They come to the cooking class and they come to the wellness educations and they meet the other spouses and family members. So they develop their own group as well. It is important for, if it's the husband who had the stroke and it's the wife who does the shopping and cooking, to be at that class. And again, we just work with them one-on-one for that support, for the conversations that are sometimes hard to have, and bring them into that kind of family.
When you first interact with a person who's had a stroke or their family member, what is your first message to them? How do you interact with them?
Be patient, and get involved in things, because a lot of times after a stroke, they do want to pull back. But, be positive. Staying positive is huge, because there are a lot of improvements that can happen after a stroke. It just takes time.
You've mentioned so many community resources, but what do you think are the most important ones for stroke survivors and their caregivers?
We have the Stroke Wellness Club, and when you come to that, we can help you on those individual plans. But getting the therapies that they need, for whether it's cognitive therapies, physical therapies, those are important, but those are one-on-one with a therapist. So to get involved with the Stroke Wellness Club, with the Fitness Forward classes, are really, really important. Another community resource that we're very fortunate to have, and it's another free service, is the aphasia community. Aphasia is the loss of speech and language after a stroke or a brain injury. It's not a lack of intelligence, they just can't communicate it well, and which can be frustrating. But our Aphasia Community Center, you can find it at aphasiasarasota.org, and they are a wonderful resource for that as well.
Where should patients and caregivers go? Maybe right initially after they've gotten out of the hospital, or they're finishing up that physical therapy. Where should they go to find some of these resources?
They need to first make an appointment with Jill Garrett at the TIA and Secondary Stroke Clinic. Jill is our nurse practitioner. She works in connection with Dr. Concha for our clinic, and it can be a couple-hour appointment, but she's going to go over all the tests that she sees. She's going to explain all those. She's going to explain the medications. She has flyers to all of the classes, nutrition classes, exercise classes, support groups. So she's a wonderful resource. So for me, if I had a stroke and had just left the hospital, I'd be making that appointment.
Wanda Jackson, thank you so much for joining us today. Before we go, I just want to ask if there's anything else you want to add, anything about life after a stroke you think is most important.
Again, it's get educated. You got to do the work. You can't just stop things. You have to continue on that path.
Awesome. Thank you so much again for
You're
joining
welcome,
us today.
Allison.
As always, we encourage everyone in our community to visit smh.com for the latest from Sarasota Memorial. Have a great day.